So I have a couple of questions about the course that we're taking now. One is, do you have recommendations for your clients, say they're in subacute or, doing okay? Do you say, try to avoid this kind of thing or that kind of thing because it will impede the progress that you're making with the treatments? Or do you say, go live life and
No,
whatever?
no. No, it's super important. But no, it's very important for chronic fatigue. I did a protocol and it looked like nothing. But I really took care using technique that doesn't aggravate them. Some people are so sensitive, they will be aggravated and they will never come and see you or any other body worker or any other manual therapist or any other therapist, maybe, because they will go back to bed for 1 month, 2 months, 3 months, and it's too much for them. Some of them just get the strength to go see you and then you just make them worse. So any high velocity usually aggravate them. Fascia work, because you pull and push and go enter duality, aggravate them. So a lot of those techniques are gentle, fluid, so you go in unity, maybe except the way you're going to work with the bone intraosseous on the sacrum is a little bit more, duality, but it's just very fast and you don't do a whole treatment on that. And then the membrane, hopefully you do it gently enough. So you really don't want to aggravate them. So try to see whatever pulling, pushing. I don't want them to have a massage. And they usually know. I don't want them to do something that they know will aggravate them because they want to integrate the work. And definitely high velocity osteopath chiropractor usually aggravate them if they're not trained specifically. So aggravation is something you really want to avoid.
Okay, so while you're doing your series of treatments, if you get lucky enough to not aggravate them, and you recommend that they really stay within the zones that they know are safe.
Exactly. With the food, drink a lot of water after your treatment, rest a little bit, things like that. If you have a little bit of aggravation, it shouldn't be for long because the technique we use are there so they don't get aggravated, hopefully. The best of what I could find.
I have one more piece to that question.
Yeah.
Is there any movements, exercises, breathing, anything that we give them as homework to take home? And maybe we just haven't covered that yet, but
no, because it's too, to release the tension in an epidural is very, very specific. The phreno-pericardial ligament, super specific, the vertebral pericardial ligament, and this and that. So usually exercise in general make it a little bit worse, but long-term they like it. So I'm not even forcing the exercise. I want, just as you said, whatever they know that doesn't aggravate them, they continue. So if they like the exercise, they continue. If they don't, but not immediately after your treatment. Wait, maybe 48 hours or 3 days, they can exercise. So they let the treatment stay inside of their body and settle in. And hopefully 1 2 treatments, they're going to get 80% better. So they can do so much more after that. Yeah. And hopefully if you hit the emotional piece, all those reactions to duality, dual movement, to opposition, pulling and pushing on them. So all those things disappearing will make them react much, much less. So it could be super fast. Before it was 20 sessions and I would be exhausted if I don't have a specific protocol. When I didn't have a specific protocol, I tried and I was working, on the liver, and sometimes it works, sometimes it doesn't work, on kidneys. This one is so fun.
Yeah, well, I really appreciate the way you've put so many different aspects and modalities together like this. Thank you very much for this program.
And you see that you can use a lot of those techniques separately for other pathology, like we talked about and people with heart problem and things like that. Yeah.
Yeah.
Perfect. Pleasure.